Welcome friends. We are revising homeopathic remedy Magnesia phosphorica. Its common name is phosphate of magnesia. It belongs to mineral kingdom and its formula is MgHPO4 7H2O. This remedy was proved by Dr. W.H. Sushler. Here we are dealing with part 2A PQR review in classical format. The text is been taken up from Ellen's keynote, and this is a good study for BHMS students, interns, house physicians, and professionals at large. I am Dr. V.K. Chauhan, homeopathic physician. So, why classical format is required? Let us evolve this particular idea first. And the idea comes from the Organon Aphorism 5, which tells us about the essentials of case taking to achieve a cure. And here Hahnemann tells us that a physician who is assigned to cure, he needs to know the particulars of the most probable exciting cause of acute disease. If you are treating acute disease, you should know the exciting cause. And if you are treating a chronic disease, you should be aware of fundamental cause, which is usually a chronic miasm. And all that information, relevant particular information, which is physical constitution of the patient, his intellectual character, his occupation, mood of living, habits, his social and domestic relations, his age and sexual functions are important. Now, from the Boenninghausn's point of view, where he has to collect the totality of the disease, he tells us about 7 essential points. And they are number one, quiz, who, the personality of the individual, which includes soma, the physical component of personality, and psyche, the mental attributes of the person. Then he tells us about quid, what? Disease, its nature and peculiarity, whether it is acute or chronic. Then UB is where the seat of the disease. From homeopathic point of view, it is miasm. Acute miasm flare is the acute disease. Flare of Sura is acute disease, and chronic activation of miasm, whether it is Sura, psychosis, or syphilis, it leads to a chronic disease. And then cubitus, cubus, auxilis are the concomitant. Here, accessory symptoms are very important from Boenninghausn's point of view. And cur is the why. The fifth point, cause of the disease. Exciting cause, as we know, in chronic disease miasm, and maintaining cause. Quemado tells us about the modifying influences, which is aggravation and amelioration, like food, drinks, weather, position, heat and cold. And Quando is the time modality of aggravation and amelioration. All these things are incorporated for the study of materia medica in the classical format, which includes the guidelines given in Aphorism 5, as well as you will find the Boenninghaussen's 7 points. These are included in the following headings. Number one is the constitution, and here we find somatic features, which is age, sex, build, and the psychic component, which is temperament, and mental aptitude, will, understanding, emotion, love, hate. Followed by second important heading is the causation. For causation, we have diathesis, seat of the disease. Intrinsic means miasmatic, whether it is fundamental cause sora or it is acquired miasm, psychosis or syphilis. And then we come to exciting cause, cur. Cause of disease, exciting and maintaining causes are need to be known, and they are must for acute disease. Third is the characteristic symptoms. It is going to tell us disease and its nature and peculiarity in terms of totality of symptom. You will find characteristic physical and mental generals. characteristic particular general, and it also includes concomitant symptoms. Then we find if we have this much of information in materia medica, we can just go to recall relationship whether similar medicines, antidotal medicine, and follow medicines are important. Followed by we have general modalities, which is the influence of aggravation and amelioration, which also includes the time modality. And then we have, on the basis of above information, we are going to erect the active predominant miasm. And on the basis of this miasm, you are going to chalk out your posology, most suitable remedy and its potency according to the susceptibility of the patient. You will select probably intercurrent miasmatic remedy or a constitutional remedy or an acute remedy or a subacute remedy or second prescription. So friends, now we recapture the general information from which is not given in Allen's keynote for magnesia phos. The very first thing which we require, which we know, is the remedy profile. It is a biochemic remedy and mainly suitable for crampy neuralgic pains, and they are better by warmth. We have kingdom and it belongs to mineral kingdom, and source of the remedy is it is a chemical compound, can be purchased from the chemist shop. The preparation. This salt is triturated with sugar of milk to prepare decimal triturations according to the rules of homeopathic pharmacy. This remedy, again we will recall, was proved by Dr. W.H. Sushler. He is the father of 12 tissue remedies. And the organ tissue affinity or the sphere of action of magnesia phos includes nerves, muscles, face, head, right side of the body. The Allen's keynote, let us go for proper PQR review in classical format with add-on information here and there. So the constitution, the somatic attributes of Magnesia phosphorica is it is the best adapted medicine to thin emaciated persons of highly nervous organization, dark complexion. So emaciated person and who have dark complexion, these are the people who are most suitable for magnesia phos. Their thermal sensitivity, you will find that there is a great dread of cold air, of uncovering, of touching affected part, of cold bathing or washing or moving. It is given in PQR4. It is a thermal affinity. And then for side affinity, there is affections of the right side of the body, head, ear, face, chest, ovary, sciatic nerve, and similar remedies which are going to act on the right side of the body includes belladonna, bryonia, chelidonium, calicarb, lycopodium, and podophyllum. This is given in PQR2, side affinity of magnesia phos. Friends, let us go to the constitution, and it is in the psyche part. In temperament, it is nervous temperament, nervous, anxious, or you can say nervous, anxious temperament. Yes, of course. And we have mental attributes. The patient laments all the time about the pain and he is unable to think clearly. This information comes from Boric Materia Medica. Dreams, we don't have any important dreams here. We don't have very important desire also here. Aversion is for coffee and there is a food aggravation is a cold drink. The information comes from Kent repertory. Now causation is the second important title we have here. It includes diathesis and ailments of teething children, spasms, during dentition, no fever. So the age and phase of the life is the infant. The infants during dentition period are much more vulnerable for spasms. But these spasms are without fever. If with fever is there, please remember There is a hot head and skin also, and remedy will be belladonna. It is PQR7 which tells us about ailments from or diathesis. Now let us go for exciting cause or stressors. Complaints from standing in cold water or working in cold clay. So similar symptom you will find in calcarea. And this is the PQR6 ailments from exposure to cold. Now we go to the characteristic generals 3A, and the very first thing here we find the pains. We have every type of pain in magnesia phos: sharp, cutting, stabbing, shooting, stitching, lightning like coming and going. Similar to belladonna, the pains are intermittent. Paroxysm becoming almost unbearable, reaches peak within minutes, and it becomes patient becomes agitated and frenzied. Rapidly changing place. This is a neuralgic pain which is going to change place rapidly, because if it is inflammation cannot shift so suddenly. And similar symptom you will encounter in case of Lacan and pulsatilla also. With constricting sensation, these pains are associated with constricting sensation, and for this modality you will remember cactus, iodium and sulfur. Now the cramping pain, it is neuralgic affections of stomach, abdomen and pelvis. Similar remedies you will find colophyllum and colocynth. Please remember, the abdominal pain which is cramping is the viscera which we find in abdomen and pelvis. So in abdomen we have got stomach, we have got duodenum, we have got jejunum, we have ileum, we have colon. So this is hollow viscera, intestines. Then we have tubes like common bile duct, we have hepatic duct, cystic duct, and we have ureters. And in pelvis you will find urinary bladder and uterus, fallopian tube. These are all important viscera where involuntary muscles are there. These are circular muscles which, when they constrict, when they go into the spasm, they cause cramping pain, and it relates to abdominal and pelvic viscera. And next important symptom in characteristic general is languid, tired, exhausted, unable to sit up. This is PQR5. This particular symptom is this patient is anxious, this patient is in agony, and he is suffering from pain. So his autonomic nervous system, sympathetic nervous system is overactivated, and such patients get exhausted. So they become totally neurasthenic. They are run down, unable to sit up. They become very weak during the suffering. Now we go to the characteristic particulars of magnesia phos. The very first thing which is important is head region, and in head region we have headache. Let us see the location, and its radiation begins in the occiput and extends over the head. Especially, it is a right-sided remedy, so we have sanguinaria and silesia. Similar symptoms. The client who is going to suffer from headache of school girls. So it is young females, puberty, during puberty and thereafter you will find that is the client who is more susceptible. Face is red and flushed, so they are plethoric at this moment. They are healthy people, they are plethoric people. And it is worse from mental emotions, exertion, or hard study. So, mentally, if you are using your mind profoundly, probably it causes a stress. Emotion also causes a stress, and physical exertion also causes a stress and precipitates the headache. The time modality here you will find 10 a.m. to 11 a.m. or 4 p.m. to 5 p.m. And then amelioration is by pressure and external heat. And this symptom comes from PQR8 headache, particular general. In the facial region, we have neuralgia. So facial neuralgia is also known as tic douloureux, trifacial neuralgia, Furthergill's disease is the name for trigeminal neuralgia or facial neuralgia. And here we have supraorbital or infraorbital right-sided pain. So this particular diagram depicts the trigeminal nerve which has got trigeminal ganglion. From trigeminal ganglion there are three branches are coming up. The uppermost branch is the ophthalmic region, and from ophthalmic region this particular branch which is going up in the frontal region is supraorbital nerve. So it can have the pain, or you have infraorbital nerve. Infraorbital nerve is the branch of maxillary division of trigeminal nerve, and you will find pain over here on the right side. This picture depicts the left side. However, please remember it is a right sided pain. And third division is the mandibular division, which is a mixed nerve, sensory and motor. The motor supplies to muscles of mastication, and lower jaw and gums are supplied by mandibular nerve for general sensation. Friends, the motor supply of face is the facial nerve, which is seventh cranial nerve, and trigeminal is fifth cranial nerve. What kind of a pain? Character of pain is intermittent, darting, cutting type of pain, which is worse by touch, cold air pressure and pressure. They are ameliorated by external heat. This is PQR 9, particular general facial neuralgia, given in Allen's keynote. Now we go to the toothache, and here toothache at night, rapidly shifting, worse eating, drinking, especially cold things, and it is better by heat. If it is better by cold, please remember the medicines which are important are bryonia, coffea, and ferrum phos. And we go to the pain, stomach region, spasm or cramps of stomach with clean tongue as if band was drawn tightly around the body. It is PQR 11, particular general stomach cramps. We go to now abdomen, and in abdomen we find colic. What kind of a colic? We have flatulent colic, forcing patient to bend double. Flatulent colic is usually commonly seen in infants, and anything which is going to cause fermentation in the GIT tract or stomach, like milk and carbohydrates, they are the things, beans, they are the things which create flatulence. Another cause of colic in the intestine is where the flatulence is there. It is in adults, most probably it is irritable bowel syndrome. The colic predominant irritable bowel syndrome is there. These pains are better by heat, rubbing and hard pressure. Please remember hard pressure. Similar remedies are colocynth and plumbum. And then we go to a extended information here. There is the veterinary medicine. We can use magnesia phos for of horses and cows. This colic of horses and cows when colocynth fails to relieve. It is PQR 12, particular general abdomen colic. Now we go to the female genital tract, and here we have menses, early, flow dark and stringy. So there is polymenorrhea early, and there is a pain worse before and better by when flow begins, like leukocysts and zincum. Discharges, they produce relief. Here this dysmenorrhea is a secondary dysmenorrhea which is known as congestive dysmenorrhea, and the primary dysmenorrhea is spasmodic dysmenorrhea. Pains are darting like lightning shooting, which is worse on the right side, better by heat and bending double. We have additional symptom here, vaginismus. Vaginismus is a spasm of vaginal muscles, and it is a typically very painful condition we find here. Now, next is the symptom which is coming from the urinary tract, and here we have enuresis nocturnal from nervous irritation. Urine is pale, copious after catheterization. It is PQR 14. So, enuresis nocturna, especially in kids who are having nervous irritation Or there is another condition where the urine is much more copious, so there can be frequent urination. So copious urination, please rule out diabetes mellitus or urinary tract infection or any other cause. Say for example, if the patient is drinking too much of water, polydipsia. And after catheterization, generally catheterization is required in elderly persons, especially males, who have prostatic enlargement which causes retention of urine, or there is a stricture of urethra, so people pass catheter to dilate it. So here it causes irritation to the urethra, or there can be infection, secondary infection can be there. Now we go to the next important symptom, which is cramps of extremities. Cramps of extremities generally we will find after much more exertion, vigorous exertion in hot climate, or in cases of dehydration, or where there is calcium deficiency, or there is vitamin B complex, or you can say vitamin E deficiency is there. Now during pregnancy what happens, you see, the total economy has got certain changes in the female system and that retains water, and hormones changes are going to bring about the changes which are going to cause cramps in legs. But apart from this, the female who is pregnant will require more of minerals and calcium. If she is not getting it, minerals and calcium, probably deficiency will also contribute towards the cramps in legs. And thereafter comes the writers, cramps of writers, piano or violin players, such people who are engaged in such intricate repeated movements. They have occupational cramps. These occupational cramps use the hand muscles, intrinsic hand muscles, which are fine muscles, repeatedly so much that they go into the spasm and ultimately they hurt him. So it is a good medicine for writer's cramp or occupational cramps of piano and violin players. Friends, let us go to the relationship, and here we compare with belladonna, colophyllum, colocynth, lycopodium, laccan, and pulsatilla. An important information is chamomilla is vegetable analog of magnesia phos. Sometimes acts best when given in hot water. So it is a posological component given here, and antidotes Magphos, belladonna, gelsemium, and lachesis are antidotes. Now, general modality, the aggravation, cold air, a draft of cold air or cold wind, cold bathing or washing, motion and touch, especially this touch is the fine touch, light touch. Amelioration is by bending double, heat, warmth, and pressure. Hard pressure, firm pressure is going to relieve. If there is a burning pain which is better by heat, please remember arsenic is the medicine, because all types of pain are encountered in magnesia phos, but we do not have the burning pains. So, on the basis of above information, let us go for miasmatic analysis. So, let us pick up the miasmatic markers. The very important miasmatic marker is that most of the diseases where the magnesia phos is given is of self-limiting nature. So they are functional symptoms, so they are going to represent psoric miasm. However, colicky pain is the psychotic pain. From above, we interpret or we come to the point that magnesia phos has predominant psoric miasm. Now, for posology, Schussler recommends 6x trituration. Dr. J.C. Morgan advises 30x in water and frequent doses in colic. Even in CM potency, it works in dysmenorrhea. Sometimes acts best when given in hot water, and repetition, repeated frequently. It tolerates frequent repetition from half an hour to 1 hourly according to the acuteness of the disease and the duration of action. We are not very definite and sure about it. So, friends, this medicine is best suited in headache, schoolgirls headache, ciliary neuralgia, cluster neuralgia, trigeminal neuralgia, toothache, colic and cramps in abdomen, cramps in legs, dysmenorrhea, nocturnal enuresis. Already we have talked about cramps. So friends, thank you very much for watching and listening patiently. Sharing is caring. Thanks once again.